Post-traumatic stress disorder.
PTSD, or post-traumatic stress disorder, is a response to stress that happens outside of usual human experience. It can show up in 3 different ways or clusters. The first way is through re-experiencing events. This can be through nightmares or flashbacks. The second way is numbing. This is the detachment or the loss of interest in people or activities in daily life. The third cluster is miscellaneous, and it can be found through exaggerated startles or memory impairment. According to the DSM-4, or the Diagnostic Manual for Psychiatric Health, an individual with PTSD had to have experienced an event that threatened injury, integrity, or even death. The way that PTSD affects the brain is through the hippocampus. It wears and tears on it, which causes a reduction in its volume. This is important because the hippocampus is responsible for memory functions, meaning it helps us distinguish between past and present memories.
The most common cases where PTSD is recorded from children is when there was sexual or physical abuse or a close relative's death. PTSD can be shown most commonly as an anxiety in children that is experienced in nightmares and the possibility of reoccurrence from a traumatic event. It can be harder to focus in social groups, school, and at home because of the constant fear of the traumatic event reoccurring. Certain triggers that relate to the traumatic event can cause anxiety and panic attacks. An example of a trigger would be if a child was physically abused by a woman that had bright red hair and then came across a woman that had similar hair. The child would experience flashbacks of the traumatic experience and could experience an anxiety attack, but this is generally experienced in the more severe cases. People who are not understanding of their anxiety can be judgmental or punish them because of their behaviors, sometimes saying they are overreacting because they are children. Children can begin to act out in harsh ways, such as tantrums, breaking harsh social norms like laws, becoming depressed, and begin to separate from family members and friends. This can make the PTSD victims feel as outcast in social groups and become lonely. Being a minority can increase the severity of all of these actions and symptoms because of the discrimination that they can face. Later on in life, the symptoms from PTSD can decrease and the victims can live on and be accepted into social groups. In more harsh cases, the victims can still have anxiety or panic attacks, break social norms, and experience depression and loneliness.
In America, almost 3/4 of women and over 2/3 of men living with PTSD are parents. PTSD may cause parents to have poorer parenting habits and difficulties. One repercussion of this is secondary traumatization or intergenerational transmission of trauma, in which children may mimic or display similar symptoms to those of their parents living with PTSD. This can cause child behavior problems, family violence, and stress between members of the family and their relationships. Self-report methods were conducted in which researchers used interviews and others' list of questions to study the impact of PTSD symptoms on the family. This also showed that 95% of the veterans tested above the average for anger issues on a problematic scale. Veterans with and without depression all suffered from feelings of neglect and isolation from family members and from the world. PTSD symptoms can cause parents and the family to be distant and less associated with their children. High levels of fear and loss of control made it difficult for parents to be supportive and present in the children's lives. Children would react in such a way as forgetting about their parent and family matters and isolating themselves from the parents suffering with PTSD.
There has been a direct known correlation between PTSD and one's spiritual life. Many people draw on their own spiritual beliefs and teaching when coping with trauma, specifically veterans who have PTSD. Survivors of PTSD, including veterans, find comfort in knowing that they have a relationship with God. They use prayer and/or meditation for transcending their problems and use it for positive experiences among their struggles with PTSD. Spirituality is also often attributed to the willingness of one's ability to forgive themselves and others after a very traumatic event in their lives. One's spiritual life isn't always affected positively, though, when they are trying to cope with PTSD. Traumatic events are often attributed with deteriorating someone's relationship with God. Veterans with PTSD often question the existence of a higher power after a traumatic event. Many who are strong in their faith often turn the blame to God and question why he could have done something like this to them. Many veterans have also found their relationships with God being weakened after visiting with therapists. They often look to therapists for answers to their problems instead of guidance. Therapists can be used, but should only be used for guidance and advice on how to fix their problems. All of this takes time to fix, but is worthwhile in the long run when strengthening their relationship with God.
We chose to do our presentation over PTSD because I have been in my mental health clinical this semester, and I've had patients like 12 and 13 years old who have had PTSD, and it was just something that stuck out to me, and I thought this would be a good way to learn more about it.
Okay, so what I personally learned from children having PTSD, it's not always so commonly seen in adults. It's also in children. It's the fact of parents fleeing from their children and then they're just left behind. Kids not growing up without a parent. It's a child being awoken in the middle of the night with an earthquake and being scared to death, and then having later occurrences in life of being scared of going up in an elevator or something like that. Anything can happen when you're a child. Just having like a phobia of spiders when one crawls on you at night. That's what I learned.
On a spiritual level, I think it's important for us to realize that we all can have similar events that can strengthen or weaken our relationships with God, like how a death in our family can pull us away from God, or how an explosion, or how a veteran who goes through an explosion can be pulled away from God in a similar sense. But we all just need to realize that God has a plan for us and that everything will be all right in the end.
Some of the things that we learned in this was that generally people think that PTSD is something that only war veterans struggle with, but really we learned through research that it ranges from the littlest of kids to oldest of people to anybody. And the thing that we took away from it is that you just have to remember to be more considerate to everybody, because you never know who could be suffering with this disorder, and the effects from it on people themselves, on like the families that they're part of, on everybody. The effects of it can be dangerous, they can be terrible, so it's just the consideration that people need to take and that we learn through this that we have to have.
Thanks for watching!
Thanks for watching. Yeah!
Bye!
Even though you were forced to.